Hello, welcome everyone to Stroke Talks. I am Sybil Jones, the host here of Stroke Talks, and today I have my lovely. Which way am I going? Yes, my lovely guest, Miss Che-Lei. Girl, say her
Che-Lei.
name.
It's Che-Lei.
I am so sorry. I do mess up names, and I'm
It's
nervous today.
okay.
What? I'm like, what? Why am I nervous today? No. So today's talk I will tell you why I'm nervous today. It's because, as y'all know, I had a stroke 5 years ago. It was due to a rare cause known as carotid webbing. And my lovely guest, Miss Che-Lei, she also had a stroke because of carotid webbing. So I'm excited for her to be sharing her story because of it being such a rare cause, and to meet someone else who can relate and who has a story. Her story is a little different because she had to advocate for herself as well. Because if y'all saw the title, and it may cause a stroke. But when she starts telling you about her story, you're going to understand why. When I read her application, I was really looking like, wait, they said a what to you? That it's a carotid web and it may cause a stroke, but what? That's all they said. But anywho, before she introduced herself, I do want you to take a moment and support Stroke Talks by buying us the coffee. Right there, buymeacoffee.com/Stroke Talks. All of the interviews and the events that I do under Stroke Talks are free. And I'm able to continue them through people like you supporting us. So go ahead, buy me a coffee. All right, let's go. Go ahead and introduce. Girl, why am I nervous? Like, so you said you were nervous, but I'm nervous. And I've done, I don't know how many of these interviews.
Okay, so hello everybody. My name is Che-Lei Trott. I am 33 years old. I am a medical laboratory scientist and I work at a Trauma One hospital. I grew up in a small island called Bermuda and now I live in Tennessee.
And you know what? That's something we have in common too. She now lives in Tennessee, and I'm from Tennessee.
Yeah.
Now, tell us, before your stroke, did you have any health concerns, health risk, or anything that would have doctors have a stroke on your radar?
In my opinion, no. From birth, I had asthma. I was born with asthma. So I struggled with asthma all throughout to childhood. Probably before I got to college in 2011 was when I stopped experiencing that many symptoms due to my asthma. But after that, I probably had headaches constantly when I reached the age of puberty. I struggled with a lot of headaches, so I started to go to a chiropractor to get adjustments. But that's pretty much the only thing that I actually had throughout my life.
There was no high blood pressure, high cholesterol, none of the commonly known health risks for stroke.
No drugs, no smoking, nothing like that either. So yeah, it was really random when it happened to me.
Living a healthy lifestyle.
Yeah, healthy.
I mean, we all and saying healthy, because I often ask what is considered healthy.
Right.
Like when people say a healthy life, it's like, what do you really mean by that?
Yeah.
So let's go to the day that you had your stroke, which was May 2025. So just a little bit over a year ago.
Yes.
What were you doing that day, and how did you feel that day?
I felt completely fine in the morning when I woke up. I was going to a new hospital to be trained on the day shift part. Normally I work night shift, a 12-hour night shift, but this time I was going to be trained at a smaller hospital for 8 hours on day shift. So I woke up around like 5 o'clock in the morning to get ready to go to the hospital. I trained from 7 to 3, then knocked off, came back here. Then I took a little nap. I woke back up, and then I had some friends come over who was gonna finish watching the season finale of 911. They came over, we watched it, they went home, and then I was just sitting at my dining room table with my sister. She was across from me, and we was FaceTiming my mom, telling her about the opposite, eating dinner, different things like that. It was a completely fine day, and yeah.
Now, let me ask you this question about the nap. Was it a normal thing for you to take a nap after working a 7 to 3 shift? Was that just something normal that you would?
I don't know if I can say it was completely normal, but because I normally work night shift, I would have been sleeping the whole day naturally. So I guess it was sort of normal because I was out of my normal like sleep day shift, wake up on the night shift routine. So when I got home, I was tired from being up all day when I normally would have been sleeping. So I just took a little nap, probably like a half an hour nap, and I woke back up to prepare for them to come over. But yeah.
Okay, so it wasn't anything too abnormal. And I asked this question because I have shared, when I share my story about the day of my stroke, I took a nap, and people were like, "Well, wasn't that a sign for you that something was wrong?" And I'm like, "No, like
Yeah.
taking a nap in the middle of the day, like it just was like it wasn't anything abnormal for
Yeah.
me." So I wanted
Same.
to ask you that question, like, was that something that was up? Because folks, if you're just tuning in, this is my carotid web sister. So as we talk about her story, I'm going to be like, it's going to probably make me think of some of my own situations. So,
Yeah, but I think it was completely normal for me to take a nap because even when I'm off of my normal night shift routine, normally I'll wake up at 7, go to the gym, take my dog for a walk, eat breakfast, and then I'm back to sleep from like 11 to 2 o'clock in the afternoon. So I sleep a lot when I'm off work anyway. So I don't
oh,
think it was necessary out of my normal routine to take a nap after work.
okay.
Mhm.
So your friends came over, y'all watched 911,
911. Mhm.
and then what happened?
So I'm sitting down at the table and I was gonna microwave my dinner. So I got up to get my food from the microwave. And as I was raising my hand, my left hand, I felt like this weird sensation go from the tip of my fingers to my shoulder. So I turned around to tell my sister about the weird feeling that I experienced. But as I turned around, I couldn't talk. So my sister looks at me and she thought I had gotten electrocuted from the microwave. So she was like trying to ask me like what's going on, but I couldn't say anything to her. So I was like motioning for her to get me a piece of pen and a piece of paper. So she brought me the piece of pen and paper, and so I wrote on the piece of paper. I wrote stroke question mark, and then I tracked my phone. I wrote the time on this piece of paper. So I'm like still trying to get the words out, couldn't say anything. But then all of a sudden it came back. So I was like, okay, that was real strange. I couldn't say anything to you just now when I was trying to explain to you. My arm felt weird. It was hurting me a little bit okay. So after that, I went to go use the bathroom, and then I came back to sit down at the table, and I'm just sitting here, nothing else is going on. And she's like, "Oh, that was strange." I was like, "Yeah, it was real strange. Something must have happened. I don't know." But then after that, I lost my speech again. But this time, when I lost my sense of speech, it was like there was nothing in my head to pull any words from. Um, the closest thing that I can think of to describe that moment, it kind of reminded me of the SpongeBob episode where like he's like looking through all the files in someone's brain trying to find its file, but it's nothing in the files. That's how it felt. There was no words to pull from in my head. Like there was nothing up there. But that probably lasted from like probably 2 to 5 minutes, I would say that lasted. But then I can talk again. So I told my sister, I'm gonna pack a bag to go to the hospital because I think I had some sort of stroke. I don't know what's going on, but it keeps coming back. So I'm gonna go get checked out.
You wait a minute. Wait a minute. So tell us the time frame from the first time you lost your speech to the second time you lost your speech, and then you packed the bag. What? Wait, wait a minute. Wait a minute. Please, please. And I say this because for our viewers, I want them to get a full picture of someone having a stroke. And every stroke situation is different.
Yeah.
But understanding like what you were feeling, what your sister saw, and what your brain was and was not processing during that time. But I am stuck on the fact that you were like, wait a minute, I need to pack a bag.
Yeah, I knew I was going to be sitting there for a long time.
And okay, hold on real quick for everyone for the viewers watching this. Here at Stroke Talks, we have real conversation. That means that sometimes we go and laugh, right? We're the stroke survivors, and we laugh through our pain sometimes. We cry through our pain sometimes. We cuss through our pain sometimes. So, hey, if we're laughing, we laughing together. And it's okay. Y'all can laugh with us and leave us some comments. Go ahead. Leave some comments and go ahead. Let's continue because I really want to know what was going through your mind when you packing a bag.
Well, from the first time I lost my speech, that probably lasted, I would say less than probably 1 to 2 minutes. I lost my speech the first time. And then the next time I lost my speech was probably like 5 minutes after that. And that lasted probably like, I would say less than 2 minutes again, probably like 30 seconds to 2 minutes type of thing. I lost my speech again, but then it came back. The reason I packed a bag is because I'm thinking in my head, I'm like, okay, I know at work when I do my little online learning courses where they are constantly telling us the signs of stroke and different things like that, I know I felt my arm weakness. I know I lost my speech, but then it came back. And I don't feel like they ever like told us in that talk that it can come back and go away. Like I always thought it was like you would experience all those signs all at once or something else. I didn't know what the progression of the symptoms would look like. So that's why I was like 95% sure that I had a stroke, but I'm not sure why I can talk again. I couldn't really explain that to myself. So in my head, I'm thinking to myself, did I do anything to cause a blood clot, or like how could I have had a stroke just now, or like what's actually going on? So I was thinking to myself, okay, well, I was standing up for 8 hours today at training at the new hospital. I was like, okay, maybe I caused a blood clot standing up, not stretching enough, not moving around enough. I was thinking that, and then I was thinking, but I stand up for 12 hours every single night and I haven't had a stroke then. So I was just going through my head, like, what could have caused this, you know? And then I'm thinking to myself, okay, I know I'm so young. So I know they're probably not going to believe me when I tell them that I lost my speech. So it's like, okay, I'm going to prepare a bag so I can have something to read, my phone charger, some snacks, a change of clothes, just in case I'm sitting in the ER.
You said snacks.
Yes, I got hungry.
Snacks. You're like, look, I got to make sure I'm not hungry. But real quick, you said something about not knowing that someone can lose their speech and it comes back in the progression. Yeah. That is something too that is important, because before we went live, we were talking about, hey, how many people would recognize the signs of stroke, like truly recognize the signs of stroke. And with the speech part, it's always, oh, your speech will slur, or the person around you, their speech will slur. But there isn't that discussion that, oh, they may lose their speech and it may come back. So, folks, remember that. If you are talking to someone and there's a difference if someone just, they forget what they're talking about, right? Because that happens. But when they lose their speech completely, make sure you are paying attention. Be aware of that.
Yeah.
Okay, I'm sorry. Go ahead. So you had your snacks, your phone charger. Because I had to make that point. I had to go back and make that point because I do think a lot of times when we think of a stroke, we're like, oh, someone is slurring their speech or they are completely incoherent.
Right.
100%. And that's not always the case.
Yeah. And another thing also, with one of the signs of a stroke is facial drooping. But I feel like they should probably remind people that if you're younger or if you have tighter skin, you might not be able to see the facial drooping in somebody at all. It might be really hard to identify that in someone or even in yourself. You might not notice it if you have tighter skin or you're younger, like there's no skin to actually droop that much, So that was another weird thing that happened for me because I didn't see that in myself at all. Now I can see it in my smile. Like I had some pictures when I was in the hospital, and if I zoom in real closely, I can see that I'm smiling, but my smile is not even anymore. But I know when they were looking at me, they just thought that I was smiling. She must be fine, So I think it really helps if you have someone with you that actually knows you, that can point out to the healthcare professionals and explain to them, oh, this is not what she normally talks like. This is not how she normally sounds. This is not her in real life. Because that can really help a lot.
Yes. Yes. Girl, look, I'm over here like, yeah. Yes. So you have your snacks, you have your charger. Did you drive yourself to the hospital? You didn't drive.
My sister was in the driver's seat. So we're starting to drive to the hospital. I probably live like half an hour away from my location of the hospital that I wanted to go to because I wanted to go to my own job to be treated because it was supposed to be #1 for stroke people in this region that I live in. So I wanted to go to that hospital. But as we started to drive, my sister says, oh, it's a fire station in our neighborhood. Maybe you can just go there real quick and have them assess me to determine if I actually had a stroke or to do something just to see if I need to actually be more, I don't know, just to check on me. So we stop at the fire station, but the doors were like all closed up. So she had to run around it to knock on all the doors to try and get someone's attention. So when she finally got someone's attention, it was like 9 people rushed out to the car to come and assess me. They pricked my finger to take my blood glucose. They took my blood pressure again. They're asking me if I'm on drugs. I take any drugs. They kept asking all these questions about drugs, which is kind of annoying to me. But anyway, I understand why they were asking. But they did all that stuff. And then one of the EMTs, she said, oh, let's give her some oxygen. But then all of a sudden, one of the male EMTs shouts at her and says to her, oh, no, don't do that, because if she's actually having a stroke, the oxygen can actually move the clot. So they didn't give me the oxygen. So, yeah.
I didn't know that. People, that's also put that in your back pocket. Seriously, I didn't know that. Like that giving someone oxygen, if you think they're having a stroke, could cause more harm. So viewers, put that in your back pocket.
So after that, they radioed in the ambulance, and then they took me to the hospital that I wanted to go to in my region. And by this time, I can speak. I was still speaking. My blood pressure was a little bit higher because of all the commotion going on around me. Constant people asking me all these questions, all this other stuff going on. So when I got to the hospital, I wrote it down. Let me look at it. My blood pressure was 156 over 86, and that's considered to be high. So, yeah, they marked it as high. But at this point, I was at the hospital. So, yeah.
And that was due to all the stress, because at that point, it's stress because your normal blood pressure, I'm just,
pretty low. Yeah.
it's pretty low. Okay.
Mm-hmm. Yeah.
Now, so at this point, we're looking at over an hour.
Yeah, it was probably like an hour since I had my first when I first lost my sense of speech.
Okay. See, I'm asking this question because viewers, time is of the essence when someone is having a stroke. So I'm like, what? Because I'm gonna calculate how long it took them to determine it was a stroke and the care they provided. So
yeah,
I'm going somewhere with this time.
Mm-hmm.
Okay, now at the hospital.
Yeah, so now I'm at the hospital. It's probably like 10:30 at night. So they put me in an ER bed. They do an assessment where they ask me to explain to them what I was feeling. So I described to them that I have left-sided weakness. Sorry, go ahead.
I have a question.
Mm-hmm.
So when they got you to the hospital, they knew they had a stroke patient coming in.
Yes.
Right. And they sent you to the regular ER side. They didn't send you to the stroke unit side for assessment.
It was a trauma base in the ER.
Okay.
So
I'm sorry.
I guess
I'm just having flashbacks. That's all. Sorry.
Yeah.
Okay.
So I'm in the hospital ER trauma bay, and they asked me what happened. I described to them what's happening, and I tell them I lost my sense of speech, but now I can speak. But just a little while ago, I lost it again. So I'm not sure if I'm going to lose it again, or I'm not really sure what's going on. But I told them I have left-sided weakness, and that's what I told them. So they asked me to raise up my leg and to raise up my left arm. But as I was trying to do it, I couldn't raise it as high as I'm supposed to be able to raise it. So they sent me to get a CT scan, I think it was, I got first. And then after that, I got TNK, which is a clot buster medicine that they give you. So I got that. And then after that, they sent me back to that same ER trauma bay. And when it came back to do an assessment or to tell me what they saw in my CT scan, they told me, we didn't see anything on your CT scan, but you probably just had a migraine. So I was looking at him, I was like, a migraine? I said, I didn't have a headache though. And I was like, sometimes migraines can cause you to lose your sense of speech. So I was just looking at him like, okay, that's a really weird thing to have happened to me when I didn't even have a headache or nothing else happened like that to indicate to me that I was having a migraine. But I was like, okay, I guess I trust you. You're the nurse, whatever. And then he's telling me, we didn't see anything on your CT scan, but we saw something called a carotid way up. So I looked at him, I said, what's a carotid way up? Because I have never heard of that term ever in my whole life. So he told me, sometimes they can cause strokes. So I'm like, so did I have a stroke or not? If I lost my sense of speech and then you're telling me that I have this thing that can potentially cause a stroke, did I have a stroke or not? Like, I don't understand. Yeah. So that was kind of annoying when he told me that. But I was completely trusting him that I just had a migraine. So I
But
taxed
okay,
it.
but you had no headache, and you, as a kid, you used to have headaches.
Yeah, every
So
single day.
so
Yeah.
you know when you're having a headache, and you didn't have
Yeah.
migraines when you were a kid. They were
Um,
just
I had one migraine my first year of college. I had my first migraine, and then I had two more throughout my life type of thing. So I knew how to identify if I'm having a migraine, but I was just like completely trusting him. Maybe this is a new type of migraine. I'm getting older. I'm over 30. Maybe it's gonna look different in my 30s. I don't really know.
but so they gave you the clot buster, the TPA.
Yeah. TNK is what I got, but yeah.
TNK. Okay. So they administered that and then said it was a migraine. So I'm not, I'm trying to, in my mind right now, I'm trying to connect the dots, because if they give you the clot buster, there's proof of a blood clot,
Yeah.
right?
Before they
Okay.
gave me that drug, they were explaining to me the risk of taking that drug. And I think I had to sign a piece of paper to say that they can give it to me. So they still gave it to me just in case I was having a stroke. But then after they looked at me in the CT scan or whatever it was, they didn't see any evidence of the actual stroke. So I guess it was kind of just given to me as a precaution, possibly. I'm not really sure, but yeah.
See, look, we're going to continue on, because I'm, again, as a carotid web stroke survivor myself as well, and I was completely unconscious when they got me to the hospital. But I remember my husband said he had to sign the paperwork for the clot buster medication. But they were like, we are 99% sure that he's having a stroke.
Okay.
And that's why they administered it. So I'm stuck on the clot buster and them saying it's a migraine.
Yeah.
But that's a whole other conversation. But
Yeah.
and I'm asking to try to educate myself as well as our audience on this. So
Yeah. I'm not sure if it's because all of my explanation of my symptoms fit what would be characterized as a stroke. Maybe that's why they gave it to me. I'm not really sure, but I know they gave me that medicine. And then because I had that medicine, even though I can talk and I can move my leg higher than I could before, and I can move my arm now, they had to keep me there, I think for 24 hours, I think, or 12 to 24 hours. But I had to spend the night there.
did they admitted you?
Yeah, they moved me to the NICU unit, the neuro, I don't know what it stands for, whatever, some neuro unit to evaluate me or to keep me under observation for that whole night. So I just texted my friend because I was supposed to go with her to pick out some bridesmaid dresses the next day. I texted my friend, I tell her I can't come tomorrow because I'm in the hospital. I think I had a stroke, but just gonna get me here for observation. And she was like talking to me like, oh, are you sure? She was like, do you need me to bring you anything to the hospital? I said, no, the visiting hours are over. It's after 1 o'clock at this point. So everything's clear, so everything's done. But I should be out by tomorrow. They told me they just have to evaluate me. I'll be released by tomorrow. And then I texted one of my work supervisors to tell her to find someone else to cover a shift because I was supposed to go in for next to work a gap period for like 3 hours of a shift the next day. So I told her to tell them I'm calling out for tomorrow at least and to mark that on there because I can't come to work.
Girl, you were thinking and concerned about work, about getting bride dress.
I literally
Okay.
thought I was going to be completely fine when I woke up the next morning, but that was not what happened. So, yeah.
So they kept you for observation.
hmm And then at some point throughout that night, a nurse called my sister at home to tell her that I was unresponsive now and they needed her permission to do all the different surgeries that they'll have to do to see if I was having an actual stroke in that moment.
Wait, back. Wait a minute. Say this again.
I was just saying that at some point throughout that morning, one of the nurses called my sister at home and was just explaining to her that I'm not responsive and they need her permission to operate on me or to do any other surgeries that they will need to do to remove the clot if I was actually having a stroke in that moment. So yeah, she had to make that decision for me in that moment. Yeah, I feel so bad for her because I know she must have been real stressed out because my sister's younger than me. She's 5 years younger than me. Um, and I don't think she has any medical training to my knowledge, you know? So I know that must have been really stressful for her to have to make such a big decision for me, especially not even really understanding all the terms and what will actually happen, how are they gonna cut me open, how are they gonna go in me, everything else, you know? So it must have been really difficult for her to deal with all of that for me.
How is your sister like now? It's been a little bit over a year. How is your sister now? No, like just knowing she had to make that decision for you.
Um, I have asked her in the past, like I always tell her, thank you so much for being here. Like I'm so happy that you was even visiting me because she doesn't live with me, so she wouldn't have been here normally. So I was so happy that she was even here with me to begin with. Um, but now when I ask her, she just tells me that she had to do what she had to do for me and that she loves me really a lot. She loves me a lot and that it was stressful for her in that moment. But she just had to trust that she was making the right decision for me and she told them to do whatever they needed to do to save me. So they took me in and did everything they had to do.
And look at this beautiful woman today. And I'm like, I'm about to cry. Because it's one of those moments, like especially as a young, because you're young, you're like you're living your best life, and you realize in the blink of an eye, your life
Mhm.
can flash in front of your, because you were there with your sister and your friends when it all started,
Yeah.
and it really makes you have an appreciation of life, right? Because I think most people we're just going through life feeling untouchable.
Mhm.
And then you have a moment where this is one of those uncomfortable stroke jokes that I make to keep, and it's one of those things that keep me from like really crying. Then you're suddenly just hit upside the head, right? Like, and it kind of brings you back to the moment, like, oh yeah, no, I'm not invincible. Like
Yeah.
something can happen to anyone at any moment. But I
Mhm.
am glad that your sister was there
Yeah.
and making that decision, as I'm sure is a very stressful and scary thing to do. And if she's like anything like my husband, because my husband was the one that made the decisions for me, like he still doesn't talk about it. If I ask him
Mhm.
about it, he diverts to a whole nother subject. I'm like, dude, no, let's talk about this. How
Yeah.
do you feel?
Yeah. I can't even imagine having to make that decision for her. I don't know what I would do in her situation if it was her in the hospital either. So yeah, all I can say is I'm so thankful for her, and I'm happy that she actually picked up the phone because sometimes she can sleep through anything. She won't hear the phone ringing at all. But for some strange reason, she was able to hear the phone ringing. She picked it up and gave him the okay to operate on me.
And
And honestly,
she gave the permission for them over the phone to.
yes, to carry on with all the operations or whatever else they need to do to remove the clot and save my life.
Now, if you don't mind me asking, and you can share as much or as little as you would like about the surgery and post surgery.
Mm-hmm.
I'm just going to leave it at that. I'm going to leave it as an open ended question for you to just jump in.
Well, for those surgeries that I had when I was in the hospital the first time, I don't really remember what they actually did to me since I was unresponsive. I don't really know if that means I was unconscious or whatever it means, but I was unresponsive. But I remember when I woke up, the next morning when I woke up, I was just in a hospital bed, and all these nurses and residents came in with my neurologist, and he told me that I had a stroke, and they're like doing all these tests to evaluate me. So from that moment, I was just like sitting there like, dang, I had a stroke. I thought I was gonna be fine, you know. You told me I was having a migraine, and now I had a stroke. So I was sort of like, I know I was really quiet that whole time that I was there. I don't really know if it was due to the drugs that I was on or anything else, but I don't remember trying to talk that much. I was just like in disbelief and sort of apathetic, I guess, to what happened to me. So I remember one of the nurses, a resident, she was doing the light tax where they have a light and they shine it in front of your eye and they do the age to actually to follow them. When she came closer to me, I kept trying to grab the pan out of her hand. And I don't know why I was doing that. And that's the strangest thing to me. I was like, why was I trying to grab the pan from her hand? You know, like that's such a weird thing to happen. But I couldn't control it. That's just what my body wanted to do for some strange reason. But yeah.
Now,
Um,
you did they ask you your name and if you knew where you were and why you were there? And then have you repeat words like say short sentences?
I do think they asked me those questions, but I don't remember being able to answer them because my sister had told me that they told her that I probably wouldn't be able to talk ever after they did what she gave them permission to do to me. So I don't think I spoke that first day, but then my sister was telling me just before this actual interview that she told them that I had called her by her name, and she told them that, oh, she said my name yesterday, and they was looking at her like she was like lying to them. But then another time I said it, I called her name in front of them, and then they knew that I can talk at that point. But I can only say no. I can say my sister's name. I can say mom. I can say my boyfriend's name, which is just two letters, BJ. I can say that, but I couldn't say a complete sentence. I couldn't say a lot of different things. So I knew I was having aphasia by then too, but that's all I actually knew.
Did they start like speech therapy or physical therapy or occupational therapy with you while you were in the hospital?
Not for that first week. I had occupational therapy, I guess. I don't know if it was considered occupational therapy or physical therapy, but basically this nurse came in or this physical therapist came in and he was trying to emulate me, got me to walk better and teach me how to walk again. So that's the only actual therapy that I received for that first week. He came there to help me to walk and to see if I can stand still on my legs, and he would push me to see if I had good balance and different things like that. but I never had a speech therapist come to me on the first week. I think for me, they was looking for someone to move out of the rehab facility that I have to get sent to. So I think they were waiting for a spot to put me in. So that's why I was in the hospital for a week, just sitting there doing nothing, watching TV, starving. I was starving to death there because I am vegetarian. And for some reason, they didn't seem to remember that I was vegetarian each day. So they were always bringing in like country fried steak, big pieces of chicken. And I'll be looking, I'm like, I can't eat this, but I couldn't speak. So I couldn't tell them I couldn't eat it. So I was like literally starving. I was saving all the little fruit cups I'll get from breakfast. I was saving them to eat later to try and help me from starving the rest of the shift or the rest of the day. But yeah, it was a terrible experience there just to sit there and not be able to converse with anyone, you know?
Now, so you said, because you were saying that they brought like the chicken fried steak and the chicken and everything. So they did not, now you're vegetarian, so that should have been something they took care of. But
Yeah.
it sounds like they did not modify your diet as a stroke patient. And I say that because with carotid webbing and not having high blood pressure or cholesterol, that was one of the things when I was in the hospital, which so they didn't bring you, you're vegetarian, so they were just bringing you whatever. For me, I did not have a restriction on my diet.
Okay.
Right, because most times if you're a stroke patient, they give you that modification of your diet in the hospital because of high blood pressure, high cholesterol.
Mm-hmm.
They kept bringing me food that was modified for patients with high blood pressure and high cholesterol. I'm like, nah, I can eat. See the board. I can eat whatever. Like, bring me seasoning.
That's hilarious.
They eventually got it right.
That's
but
good.
I'm like, nah. But so you mentioned aphasia. Tell our audience what aphasia is.
Aphasia, to my knowledge, is a communication disorder where sometimes you can't properly communicate the words that you want to speak, or you can't actually understand the words that are spoken to you sometimes, and sometimes it can affect your writing and reading too, which are all things that happened to me. And now, after I went to the speech therapist for the first time, I was actually diagnosed with aphasia and apraxia. And then apraxia is basically your brain doesn't know how to tell your muscles how to move in the right way to form the words that you're trying to say. So I have aphasia and apraxia, and so that can be really hard for me, like to form words sometimes. Sometimes I have to constantly repeat them to make sure my mouth is moving in the right way to make sure I can produce the sounds that I need to form.
So
But yeah.
for someone who's watching, who is like, oh, nah, you sound perfectly fine. What would you like them to understand? No, I'm being serious because this is something that drives me insane. I'm like, and you try to keep yourself from cussing someone out. Look, folks,
Yeah.
I'm being real with you right now. You'd be like, no, please just listen and understand. So, what would you say to someone right now to help them understand that yes, you sound perfectly fine now. You look perfectly fine.
Mm-hmm. Yeah. When I say this, I'm gonna think that I'm talking to myself as a younger person because I actually had a classmate from my primary school or elementary school. Her dad had a stroke, and he's the first person that I have ever met that had a stroke. And what he was left with was physical signs of it, like where he couldn't really walk as straight. He kind of had a limp, different things like that. And I feel like most people that don't know people that have had strokes, that's what they think of when they want to diagnose someone of us having a stroke. But I would like to tell people that a stroke person could look as normal, completely normal as possible. Sometimes you can't see anything on their face. Sometimes they just look like a normal person, but they can have they could have experienced a stroke still, regardless of what they look like physically. Um, and for everyone else that can hear me speak clearly now, it took me a month to be able to even say a complete sentence in a coherent way. So, yeah, it took a long time to be able to speak the way that I speak now. And I still need to practice more. I still have to practice to say things I need to say even to this day. But what I can say is that I am just constantly progressing and surviving. And yeah, that's what I can actually say.
Yes. And like stroke is a brain attack. So
Yes.
a lot of the I don't want to say struggles, but the deficits, a lot of them are internal as well, like the mental health side of having a stroke.
Mm-hmm.
Um, those scars are invisible, even with the
Mm-hmm.
movement. Now, so your left side was affected. And when you
Yes.
mentioned at the beginning, you had that feeling in your left arm.
Mm-hmm.
Do you have nerve pain now, or do you have the weakness or heaviness of the left side of your body?
Actually, one time, sometime this year, probably sometime in the beginning of June or the last week of May, I actually felt the same type of heaviness, weakness in my left side again. And I went back to the ER because I thought I was possibly having another stroke. So I went back to the ER to get checked out, and they didn't see anything on me again, no clots, nothing else like that. But when I saw my neurologist the next day, he was explaining to me he thinks it's really strange. So I keep feeling everything on my left side, since it's my left side of my brain that was affected. And normally, if it's your left side of your brain, it normally affects your right side of your body and vice versa. But for some
Okay.
strange reason, I always feel things on my left side of my body. So I don't know why that constantly happens to me. But to this day, I don't think I have any nerve damage. I have some pain in my right leg, but I'm not too sure if that's actually due to anything that happened in any of my surgeries from my stroke or anything like that. But I do know that they went up on my right side of my groin to do my mechanical thrombectomy. So I'm not sure if that's what caused all this that I'm experiencing now, or if it was just always there and I don't remember me being in this much pain that I'm in now. But yeah, I always have pain in my right leg now too.
And that is something that I think a lot of people are unaware of with stroke survivors, that there is or there can be a constant pain.
Mm-hmm.
I will tell I am in constant pain of my left side of my body.
Dang.
And it's like, what is this? And it's always cold, like
Hmm.
cold to the touch, which is, oh, what? Sorry, something just popped up on my screen, which is weird. But tell us, because I do want to get to this part of your skin. Well, yeah, with the carotid webbing, they repaired it. They repaired your carotid web, correct?
Yes.
With a
Yes.
stent. So my step sister as well. So tell
Mm-hmm.
us a little bit about that.
Okay, so the first time I lost my sense speech, it was Tuesday, May 6th. And then I got my stent surgery on Wednesday, June 11th. And for that surgery, what happened in that surgery? It was supposed to be a outpatient surgery that it was supposed to be. And basically, I went into the outpatient surgery room at like 11 o'clock. I was supposed to be out in like probably 2 to 3 hours, I think it was supposed to last. And they gave me the anesthesia, but they told me when they tried to wake me up, I was shaking a lot and I wasn't actually waking up. So they thought I was having a little bit of a seizure. So they sent me to another unit to monitor me. But then I ended up waking up at like 3 o'clock or 4 o'clock in the afternoon. And after that, I can go back home. So it was just a quick procedure that they did for me. Um, yeah.
Okay. So, do you know what your stent looks like?
No, I do not know what my stent looks like. Do you know what yours looks like?
I do. I have a sample of it.
Okay. Can I
Do y'all want
see
to see?
it?
Okay,
Yes.
it's actually upstairs. I keep it in my
Okay.
backpack. It's
Mhm.
upstairs, and I will run upstairs to get it. And
Okay.
while I am upstairs getting it, I'll be real quick. I want you to share. I know you did this already, kind of, sort of, but I want you to again to give a word of advice to loved ones of a stroke survivors, how they can be supportive of their loved ones who's had a stroke.
Okay.
I'm
Um,
gonna.
when you have a person that has had a stroke and if you are their direct caretaker, it's gonna be real hard for you and more emotionally hard for you to take care of that person. But I think one thing that you can try to remind yourself is that you're both going through the journey together. Your situation might look different to them, and you might be experiencing different learning curves and other things like that, but you're still going through something. You still lost a piece of someone that you knew. So I think it's really important to make sure that you get therapy throughout this journey for yourself also, just so that you can have someone who can understand you and hopefully give you more advice or just give you someone to listen to you as you help take care of your loved one. I think that's really important because even for me, throughout all of my stroke journeys and like before I had to return back to work, um, it was like it was constantly focused on can she walk, can she talk, can she write, but there was no actual attention to my actual mental well-being. And I think it's a huge deficit in the medical profession for stroke survivors to have that be missed in throughout your journey. I think we all need therapy, especially in regards to like medical trauma, I guess. I guess you can say it like that, medical trauma. I think everyone would need to talk to someone after going through a stroke.
Yes, and you mentioning the mental health side of it, I really think it's it is missed because it was the same for me in the hospital. It was okay, physical therapy, speech therapy, occupational therapy. There was a casual mention of mental health, but
Yeah.
it wasn't. I had all the referrals for physical therapy, speech therapy, occupational therapy, but oh, seek mental health too if you need it.
Yeah, yeah,
And you think, oh, I'm fine, right? Because that was my thing. I'm like, okay, I'm walking again, I'm talking again. Things were a little different, a little weird, but the mental health side of it blew up for us. And I say us because my family. because my family felt the ripple effect of it
Yeah.
much later. And at that time, I didn't know what was going on. I just knew there were a lot of feelings boiling up inside, and they're still there, if I'm honest with you. For me, like, they're still there.
Yeah.
But talking to someone is very important.
Yeah, definitely. I feel like for me, I've still struggling with that. I'm not sure if it's different for me, or like maybe I keep struggling with these things because I work in the place that actually treated me, or if I work in a medical setting, so it's always around me. But sometimes I can go from feeling real sad to feeling angry a lot, because sometimes I look at people and I'm like looking at the way they eat, the habits, and other things like that. I'm just looking to myself like, how come they didn't have a stroke? Why did I have to have this stroke, you know? And I hate feeling like that, you know, because I don't want no one to have a stroke if they can avoid it.
Right.
But a part of me sometimes feels the anger of that. Sometimes I feel sad, constantly feeling sad, because I'm not sure if people realize that sometimes people make jokes about having the strokes a lot. Where I am at least in my life, I feel like people make a lot of jokes about, oh, I thought he was having a stroke or something like that. So, whereas I actually had a stroke, so it's a little bit different for me hearing that, you know?
It hits
But
differently. Hits
yeah,
differently.
yeah, definitely.
And then if you say something about it because you don't fit the norm of what people think a stroke survivor looks like,
Mhm.
you're just kind of dismissed from it. People
Yeah,
just dismiss you. You're like, no, I've gone through this, but they're like, yeah, whatever. Or, oh, you didn't really have a stroke.
yeah, yeah. Or even after, when I went back to work, I felt like people were, I think they were treating me the way that they thought I should look. Like I was squeezing like a what do they call the stress balls, the little squishy ones. I was just squeezing one, and then one of my coworkers comes up to me and she says, "Oh, that's real good for your, what do they call that? What's that word? Where dexterity, dexterity,
Uh,
D E
de-
X.
dexterior. No, is it
Yeah,
dexterior? I know what you're
dexterity.
saying.
Yeah,
Look, we
it
both
was
over here
good for
like
that.
that word.
She kept saying to me, "Oh, it's real good for that." I was like looking at her. I'm just squeezing because I like to squeeze things. Like, stop trying to put me into this category that I'm not a part of. Just like let me be. I'll do my job. Don't try to diagnose me more than I'm already being diagnosed as it is. Yeah.
Exactly. Exactly. Okay, I'm gonna show this real quick. And then I do want to ask you about you going back to work and
Mhm.
how working after a stroke survivor, how that has impacted just you from you,
Mhm.
because everyone's story is different. And this drives me insane too when you talk about just work and day-to-day life after having a stroke. I don't know what she's going to say, folks, but I have a lot of feelings on this. Okay. This is the stent.
Goodness gracious.
And when you look at it, this is kind of big. And they described it to me as like your artery being the size, like think of a straw, and this fitting into a straw. And I'm like, this is wider than a straw. So I'm like,
Mm.
how is it? It's about like, oops, I just dropped it. I dropped it. But it's right here. Is it about right there for you in your neck? Do
Yeah.
you feel it?
I don't think I feel it anymore. After it healed, probably like a 2 to 3 weeks later, I don't feel anything in that side of my body. But I don't like people touching my neck anymore, because I
Yeah,
used to like getting massages, constant massages, but now I don't like anyone touching that area at all.
yeah. Don't touch me. And if you hug
Mhm.
me, don't come in too fast.
Yeah.
And lower that elbow. lower that shoulder. Because when people hug, right, they come in with their shoulder all high. You're like,
That's
no.
true. Yeah.
Now, how often do you have your stent checked?
I have it checked every 6 months. I'm actually due for a check sometime in June. I might have to call them to get that on the books. But yeah, I have another one coming up this month.
I'm like, it's already June.
Yeah.
And are you on any medication?
Yeah, I'm on 3 types of medication. I take Crestor, um, acetaminophen, and now that you ask me, I'm blanking out what it's called. Um, Crestor. What's the name of my drug?
I don't know. I don't know. But
Let me look it up. I have it.
and while you're looking it up, tell us, and then we're gonna wrap this up because look, we're gonna need a nap after talking. Because I like when you talk a lot, do you tend to be like, oh man, I need a good old nap?
Yes, it's really mentally exhausting when you talk a lot, especially if you're constantly thinking about what to say next. It can be really mentally exhausting. The name of the drug was Plavix. I'm on Plavix also. Yes.
Okay. Plavix, good old Plavix. I was on, they took me off of Plavix after the first year.
Okay. Yeah. I hope
And
I can get off it soon too, because I hate having to take medicine every single day.
yeah, that part is tough, especially if you were not taking medication before, right? If
Yeah.
you were not on any medication before, and now all of a sudden you're having to take all this different medication, you're like, what in the world? So tell us about working after stroke and how soon did you go back to work after your stroke?
My stroke was in May, and I went back to work August 1st, I think I went back to work. So I had 90 days off from work before I actually had to go back. And now when I think about it, I don't think I was actually ready to go back to work at all, because in my speech therapy, I would constantly tell all of my therapists, I just need to be able to talk at work. I need to be able to say this, this, and this at work. So that's what I was constantly repeating in my speech therapies, like calling the doctors to tell them that they have a critical, calling for recollects, different things like that. I need to be able to read numbers, because at that point I can't even identify the number and say it correctly. So that was really important for me to be able to do also. So when I went back to work, I don't think they knew what to do with me, or like how they should be able to implement me back into my new routine. So they just kind of took me, showed me everything over again. And then I tried to like go back to different departments to show them I can do the same work over and over again, different things like that. But it was definitely a huge learning experience for everyone. And even now, when I say the critical, I would say, oh, this patient has a critical potassium of 2.0, and I'll say 2.0. I'll repeat the number in letters and in words again, just so I can make sure that I'm stating it correctly and that they can hear me correctly also, because I already have an accent to begin with. So I know that a lot of people can't understand when I say a lot normally. So to add the aphasia to it, it just makes things so much more complicated regardless.
And so, but how do you feel after your shifts? And how did you, and you were saying your coworkers and your bosses just implementing you back into the work day. Did you find that you had people who, although they knew that you had a stroke, they didn't know how
Yeah.
to See, I'm trying to ask the question, but I'm also trying not to sound like.
Yeah, a lot of people didn't know how to interact with me, I think, when I came back. Some people will ask me if my heart's all right for some strange reason, and I would tell them there's nothing wrong with my heart. And yeah, I just think it was a lot of confusion because they're thinking that I should look a certain way and different things like that. But after my shifts, after the third shift, 3 days, 12-hour shifts, the third day, I am so exhausted. I can hardly actually speak coherently. And and also I think my speech gets worse at night and I work night shifts, so that's not helpful either, unfortunately. But yeah, it's just really hard and mentally exhausting to me even more now at work, honestly.
Yeah, and just also the daily task, right? Like I've tried to explain to people the simple tasks are much more exhausting now. Like going to the grocery store, going to work. And I recall going back to work when I after my stroke and I returned to my job at the time, the job that I had at the time, and I worked from home.
Mhm.
And everyone I worked with before my stroke had left the company. So I was working with a new team of people who they knew
Mhm.
what happened. And it was, hey, I'm back. I don't really know how I'm going to fit in with this job, but I'm here. I'm going to do my best. Just be patient. And I remember being told, here's a list of the expectations. And I was really shocked. I'm like, what? I've not been on vacation.
Yeah.
I've been off work. I was off 4 months.
Yeah.
I'm here. Like what? And I'm like explaining, and I even said, hey, I had gotten a headache one day, and I said, I have a headache. I need to log off.
Mhm.
Oh, everyone gets headaches. Now, I didn't have a headache. I didn't have my sign of stroke was not anything to do with a headache or anything, but I was concerned because I'm like, oh, why am I getting this headache? I
Mhm.
need
Mhm.
rest, or then also just been tired, like working for 1 hour. I was tired. I needed to
Yeah.
log off, let me go take a nap. And again, I worked from home and I worked my own schedule as long as I got my work done.
Mhm.
That was how my job had always been. And so when I got this email about expectations, I'm like, what the I did resign. I did leave that job because I'm like,
Mhm.
whoa, do you not understand what a stroke like? Yes, I remember being told, but you look fine.
Yeah.
You're because I was at this point, I was posting on social media. Well, I see you posting on social media. Okay, and
Yeah.
so there is a lot of miseducation. I say that to say there's a lot of miseducation and misconceptions of stroke.
Mhm. Yeah. It is a lot. I'm so sorry that happened to you. That's a terrible thing to experience, especially after going through medical trauma, actually.
No, that's why I was like, let me ask her how going back to work because you physically went back to a job.
Yeah. Yeah. It's a struggle every single day I have to work, unfortunately, but I'm still young, so I have to clock in and out, unfortunately. But one thing when I think about it, as I was in my rehab facility the second week after getting out of the hospital, I had to go to a rehab facility. And as I was sitting there, I was just thinking to myself, if I was to die today, I think I would be okay if I died because I feel like I have always lived my life through experiences. I've lived in a different country. I got to go on different trips. I've had awesome memories with my family. I don't have any children. That's the only thing that I probably wanted to experience in my life. But maybe it's a good thing that I have any children because then they'll be left without a mom, you know? But that's what I was thinking about in my life is that at least I was able to experience lots of things instead of like waiting until I retire to travel and to do all these other things, you know? At least I got to do lots of awesome things, or I had lots of awesome experiences throughout my life, no matter how short it would have been. Um, yeah.
No, no, and that's something that we also that people should think about, like, experience life,
Mhm.
live your life, enjoy life,
Yeah.
because you never know. You never know.
Mhm.
So, and this is one last question. I'm gonna stop asking you questions, and we're gonna get off of here. Do you drive now? And
Yes. Uh,
any? Did you have any restrictions on driving
yeah, it
after?
was horrible. I couldn't drive after my stroke. I think I couldn't drive up until I probably drove probably like I got clearance to drive after 2 months after being off from my stroke. And that was not a good experience, you know, especially since I don't live in an area where I can just get on a bus to go anywhere. Like I have to be able to drive, especially since I live alone and different things like that. I need to be able to drive. So just being able to drive simple places when I first got permission to drive was such a huge relief to me to know that I can do something for myself. Um, and then driving to Starbucks just to order a simple a chai latte, that was a huge struggle for me just to be able to speak to order it properly. Once I can finally do it, is such a huge milestone for me. I know it sounds so simple just to be able to order something through a drive-through, but when you can't form the words and sometimes you can't think on the spot as quickly as you used to be able to do, it's such a huge blessing just to be able to go to Starbucks and order a chai. That's
Yeah,
all I wanted to be able to do.
those simple things in life that we
Yes.
take for granted, right? Because
Mhm.
before your stroke, you're like, okay, yeah, going to Starbucks, ordering
Yeah.
a shot for a chai latte, no big deal. But now you're like, oh wow, I can drive
Yeah.
and I can do these things. Now, do you notice anything different about your driving after your stroke?
Um, I don't think I noticed anything different about it. Not to my knowledge, at least.
Okay,
Do
no, that's
you
good.
have do you have any differences with your driving?
I don't know if I should say this.
Okay. Now
I
you
mean,
have to say it.
I've told my husband, my kids know this. I've even said it to the doctor. Like, I'm
Mhm.
perfectly fine driving, but y'all, the road, when I'm driving, and I'm like, I know the road is not moving, but the road, when I'm driving, the road is moving. Speed,
Oh,
speed totally jacks me up.
oh no. That must be
I'm like, the road isn't moving. You're fine. Just keep driving. The road really is not blazing.
oh no.
It's not funny, but it's funny.
Yeah. Does that give you a headache when you're driving then, or you can still like focus? Because for me, I feel like that would make me have like I'm having some sort of like that type of thing going on in my body, and I'll feel motion sickness if that was happening to me.
In the very beginning, I did.
Okay.
It was a struggle, but I was like, okay, I'm cleared to drive because I was cleared to drive. So I'm like, I
Mhm.
got it. It's improved now. Unless I go for an extended period of time of not driving, then I'm like, okay, Sybil, you got to do this. But I am a very anxious driver now.
Hmm.
I'm like, why am I so anxious? Well, I guess because the road is,
Yeah.
is moving when it's not really moving. Again, one of those moments that I just have to laugh about. But I was curious to know. I'm like, I've got to ask. had to ask you that question. Like, what are you trying?
Yeah, I don't think I experienced anything like that. And I'm happy I didn't, because that would have made me feel so sick in my head. I don't think I would have been able to drive had I experienced what you experienced.
Yeah, I just think it's the speed. And I tell my
Mm,
husband I'm just recalibrating my brain.
yeah, yeah.
But all right, Miss Che-Lei, thank you for
Yes.
sharing your story. And I would love for you to come back and share more because I do want to do a panel interview with several stroke survivors and we just have again another casual conversation. You up for it? I'm putting you on the spot. I'm
Yes.
asking this from the interview. So, if you say no, everybody be like, oh, she said no.
Yes, I'll be up for a panel discussion about strokes.
Okay. Thank you so much for sharing your story. And for everyone, go ahead and support Stroke Talks by buying a coffee to help me keep bringing these interviews as well as our Mingle Mondays because 2 Mondays a month I do a private event. It's via Zoom. It's for stroke survivors, family, friends, anyone who wants to really have some real conversation about stroke because the Mingle Mondays are open discussion. I bring the topic and we just chat. And that is where you get the real. Because you're able to just openly talk. I mean, even during the interviews, we openly talk. But yeah, so go ahead, buy a coffee, help support. And thank you for tuning in and thank you for sharing your story.
Thank you for having me. I'm so glad I was able to find you on Instagram because when I was researching people to see how they were going through life after having a stroke, it was real hard to find someone that had a stroke that was of color and had actually had it from a carotid rib. So I'm real glad that I found you. So thank you for having me here too.
No, and thank you for reaching out because I do remember when you first reached. I was like, wait, she said what? Someone else who has what? All right. You saying this. I'm sorry. I'm gonna be quiet for real, but I do. You said this, and it made me think about this about people of color having strokes. Statistics do show that Black people are in the higher have the higher risk of stroke, and they have more stroke. The demographics of Black people. I can't even talk right now. See, look, it's kicking in. We have strokes more than other demographics. But when I first started looking for different communities to join for stroke awareness, I did not find a lot of Black women or Black men talking about stroke. And I was like, if our demographics is having more strokes, why aren't we talking about it?
Mm-hmm.
So I'm like, you know what? I want to talk about it. And I talk about it in my way, just raw, real, honest conversations. A carotid webbing, it's rare, but it does present itself highly in African American women.
Yeah.
Which I often ask because they say it's rare. I'm like, how rare is it really?
Yeah.
Is it that because it's African American women who are young and healthy? That's who it's presenting in. So I'm like, how many Black women are showing up to hospitals? And I have met other ethnicities who have been diagnosed with carotid webbing, but how many Black women are showing up to the hospital because they're young, otherwise healthy, and they're been dismissed? I've asked those questions and I'm digging a little bit of research. So it's important to me to share stories from everyone.
Absolutely.
From everyone. I have, I don't care what your ethnicity is. If you are a stroke survivor, I want your story.
Yeah.
Because if we're not talking about it, we can't save lives.
Yep. Yep. It's an awesome thing that you're doing and bringing the awareness to other people. I commend you for that, actually. So thank
Thank,
you for everything that you do too.
thank you. And it's I do get nervous doing it. It's
Mhm.
gets little, little nerves. But all right, folks, thank you for tuning in. Have a wonderful day. And be
Bye.
sure to buy me a coffee.
Coffee.
All right. Bye.
Bye.